Hello everyone, welcome to our third lecture on ultrasound imaging. Let's look at the objectives for today. After today's lecture, students will be able to identify different ultrasound transducers. Students will also be able to define frame rate, field of view, line density, and depth of ultrasound as it relates to real-time ultrasound imaging. Students will describe the differences between information obtained from continuous wave Doppler and pulse Doppler ultrasound. Students will be able to name the main components of a Doppler ultrasound image. And at the end, students will also learn how to determine volumetric flow from average velocity and vessel cross-sectional area. Let's start by looking at a few ultrasound transducers. Ultrasound transducers come in multiple shapes and geometries. Linear phased arrays and curvilinear phased arrays are common on ultrasound units. There are also intracavity probes that provide high-frequency imaging of anatomic structures close to cavity walls. This slide shows a few linear transducers shown here. This is a curvilinear transducer, and then on here you have the intracavity probes. Linear and curvilinear array transducers can be used to produce rectangular image field of views or trapezoidal image field of views as shown on this slide. So here is a rectangular field of view from a linear array, and here you have a trapezoidal field of view from a curvilinear array. In both linear or curvilinear arrays, the beam is shaped by electronic excitation of the transducers in a linear switched array mode or a linear phased array mode. Transducers typically have 256 to 512 discrete transducer crystal elements. As the ultrasound beam sweeps across the volume of interest in a sequential fashion, the number of amplitude lines is approximately equal to the number of transducer elements. So for 512 transducer elements, there would be approximately 512 amplitude lines or A lines. The advantages of the linear array are the wide field of view for regions close to the transducer and uniform rectangular sampling across the image. Phased array transducers are made of arrays of 64 to 256 transducer elements. All elements are involved when transmitting and receiving ultrasound signals. The ultrasound beam is steered by adjusting the delays applied to the individual transducer elements by the beam former. By varying the time delay sequence from one pulse to another, the ultrasound beam can be steered across the field of view in a sector scan. The image on this slide shows the sweeping of the ultrasound beam in 3 sectors and the composite image on the right. So you can see various sectors here, and here is a composite image. And so these sectors would all be filled in, and you'd have a composite image that looks like that. Spatial compounding is a method of obtaining different angles of ultrasound data and combining them to produce a single image. By combining multiple scan lines, speckle noise is reduced with a corresponding increase in signal-to-noise ratio. A disadvantage of spatial compounding is that it implies a persistent frame averaging, leading to loss of temporal resolution and increase in spatial blurring of moving structures. Spatial compounding can be done on both linear and phased array transducers. The image on this slide shows the scan lines from a normal scan versus the scan lines from a spatially compounded scan. You can see that there is a lot more scan lines on spatial compounding scans than on a normal scan. If you take a look at the corresponding image, this image quality is a lot better than the image you see from a normal scan. In ultrasound, the 2D image is created from a number of A lines or amplitude lines. Typically, 100 A lines are acquired across the field of view. With more lines, a higher quality image is obtained, but that reduces temporal resolution because acquisition time per scan line is given by T equals 13 microseconds times depth. This means that there is an upper limit on how many lines can be acquired before the frame time gets too long and the frame rate decreases. So there is a trade-off between the frame rate and the number n of scan lines and the depth d of the echoes as shown by the formula on this slide. So you can see here, this is the formula for frame rate, and it's equal to 77,000 per second divided by the number of scan lines n multiplied by depth d. So as I mentioned, for a fixed frame rate, increasing the number of scan lines n means that you must decrease d, or if you wanted to increase d, you would have to reduce the number of scan lines if you wanted the frame rate to remain the same. The images on this slide illustrate the principles I discussed on the previous slide. So because of the frame rate formula from the previous slide, when going from a low frame rate to a high frame rate, if field of view, line density, and n is to remain the same, then depth must decrease. And that is what is shown on this first view here. Low frame rate, this is a high frame rate, so you want to keep field of view the same and n the same, and line density the same, the depth is decreased, and that's what you see here. In this middle scan, in going from a low frame rate to a high frame rate, if you wanted to maintain the field of view, as shown here, and the depth, then you would have to decrease the number of scan lines n, and also the line density. And in this last view here, going from a low frame rate to a high frame rate, if you wanted to keep your depth the same as shown here and the line density the same, you would have a decrease in the field of view, which is shown by the narrowing of the sector, as well as a decrease in the number of lines, and that's shown here. Ultrasound images can be displayed on digital flat panel displays or on analog displays. For analog displays, the digital data from the scan converter is converted to analog signals by the digital to analog converter before it can be displayed. Window and level settings can be changed on images, and zoom features can also be applied to improve details. Two types of zoom is available: the read zoom and the write zoom. Read zoom enlarges user-defined region of the stored image. Write zoom requires the operator to rescan the area of the patient that corresponds to the user-selected area. Let's look now at Doppler imaging. I will start with a description of the Doppler effect. The Doppler effect is the shift of frequency of a sound wave caused by a moving reflector. In Doppler ultrasound, the moving reflector could be blood in a vessel. The top image shows a transducer producing ultrasound waves shown in black. The green waves are due to the motion of the reflector, in this case blood in the blood vessel. In the top image, the blood is moving towards the transducer, so the frequency of the returning echoes is increased. In the lower image, the blood is moving away from the transducer, so the sound frequency of the returning echoes is reduced. The shift in frequency in either case is called Doppler shift and is calculated with the formula shown below. And that's the formula shown here. Let's look at how the Doppler shift is used in Doppler ultrasound imaging. Doppler ultrasound imaging is used to measure frequency shifts due to the velocity of blood in blood vessels. In blood vessels, the reflector is the blood, and the velocity of the reflector can be determined from returning echoes from moving blood measured with transducers placed at an angle to the actual velocity vector. And that is shown here in green on this slide. And this is the location of the transducer. So the component of the velocity vector directed toward the transducer, which is our blue velocity vector here, is less than the actual velocity vector along the vessel axis, which is this green velocity vector, by the cosine of the angle between the two vectors. Without correction, this discrepancy will lead to less Doppler shift and an underestimate of the actual blood velocity. By rearranging the formula from our previous slide, the velocity of the reflector can be obtained by using this formula shown on this slide. As in conventional ultrasound imaging, Doppler ultrasound can be performed using either a pulse mode or a continuous wave mode. We shall look first at the continuous wave mode of operation. In continuous wave operation, an oscillator produces continuous sound waves that are transmitted and then received by the transducer. The signal is amplified, and the demodulator compares the returning frequency and the incident frequency and extracts the Doppler shift frequency. A low-pass filter separates the Doppler shift frequency from the high-frequency incident sound waves. The Doppler signal also contains low-frequency signals from vessel walls and other moving specular reflectors. These signals can be removed by an additional wall filter. An audio amplifier amplifies a Doppler signal to an audible sound level, and the recorder tracks spectrum changes as a function of time for analysis of transient pulsatile flow. The figure here shows the block diagram of this entire process. One advantage of continuous wave operation is that the Doppler shift frequency can be accurately measured because of a narrow bandwidth being used. An alternative to the demodulation technique applied to continuous waves described on the previous slide is the Quadrature Detection method. This method is phase sensitive and can reveal the direction of the Doppler shift as compared to the demodulation approach that reveals only the magnitude of the Doppler shifts. I mentioned a few slides back that we can also operate Doppler ultrasound in pulse mode. Pulsed Doppler combines the range determination of pulsed ultrasound with the velocity determination of continuous ultrasound systems. In pulsed Doppler operation, a longer pulse length is used. Instead of 3 cycles as we do in regular ultrasound, between 5 to 25 cycles are used in pulsed Doppler ultrasound. This leads to a higher Q factor, but at the expense of spatial resolution, which is reduced. The block diagram illustrates a pulsed Doppler operation showing the individual instruments used. This is not too different from what we saw a few slides back with continuous wave Doppler operation. Duplex scanning combines 2D B-mode imaging with pulsed Doppler operation. The 2D B-mode imaging provides visual guidance for the pulsed Doppler operation. Imaging starts with the transducer positioned over the vessel of interest with the appropriate size of vessel and Doppler angle of transducer chosen. This is called the Doppler gate. The B-mode imaging determines the correct placement of the Doppler system or Doppler gate. Once the system is switched to Doppler mode, the scanner extracts data only from within the user-defined Doppler gate. The duplex system allows the blood velocity to be directly estimated from the Doppler shift frequency by just inputting Doppler angle into the scanner computer for calculation. Once velocity is calculated, flow in units of cubic centimeters per second is estimated as the product of the vessel cross-sectional area in squared centimeters and the blood velocity in centimeters per second. The flow determined from duplex systems should be equal to the flow determined from using the blood velocity and the manually measured cross-sectional area of the vessel. There are multiple sources of error in the blood flow volume measured in this way. These include the possibility the vessel is curved, or the Doppler angle is wrong, or the Doppler gate is mispositioned, just to mention a few. Rather than using duplex scanning and calculating blood volume flows, we can use scalar flow Doppler imaging. At each gate position, a single parameter is extracted from the Doppler shift signal and encoded as a time-varying color. The most common parameter is the mean Doppler frequency shift, which indicates the mean velocity of flow. Images of this parameter are called color flow Doppler images. Color flow imaging provides a 2D visual display of moving blood in vessels superimposed upon the conventional grayscale image as shown in this image on the slide. In this color coding scheme, red means blood flowing toward the transducer and blue means blood flowing away from the transducer. The Doppler gate is the marked area in the right image here, and the bottom plot is the Doppler spectrum extracted from the defined gate. There are several limitations to color flow imaging. These are noise and clutter of slow-moving structures nearby, masking the returning echoes, poor spatial resolution of color flow imaging compared to grayscale imaging, and also inaccurate velocity calculations. Color 2D ultrasound units often provide duplex scanning capability to provide analysis of questionable areas from pulse Doppler imaging. In power Doppler imaging, the signals are processed to take advantage of the total strength of the Doppler signal and ignore directional or phase information. In power Doppler, the total area under the Doppler frequency shift spectrum is calculated and then displayed as a color, usually on a color scale that increases its intensity with increasing spectral energy. This power or energy mode of signal acquisition is dependent on the amplitude of all Doppler signals regardless of the frequency shift. In this mode, sensitivity to motion is improved at the expense of direction and quantitative flow information. The images on this slide compare color flow imaging with power Doppler imaging, showing intense areas on power Doppler not shown on the color flow imaging. But in the power Doppler images, there is no directional information as in the color flow imaging. A comparison of the key characteristics of power Doppler imaging and color Doppler imaging are shown on this slide. Color Doppler is related to flow velocity, while power Doppler is related to blood volume. The table lists other differences as well, as you can see. So you can go through this list and look at the dependencies on theta for the color Doppler imaging, and you can see power Doppler is independent of theta and so on. Let's look at some other ultrasound applications. Ultrasound can be used to make accurate distance, area, and volume measurements because the velocity of ultrasound in soft tissue is known to within about 1% accuracy. An example of common distance evaluations is for fetal age determination by measuring fetal head diameter or circumference as shown on this slide. You can also measure femur length as shown on this portion of the slide. Ultrasound contrast agents are microbubbles of between 3 to 5 micrometers in diameter encapsulated in human albumin. Because of their small size and stability, there is the possibility to perfuse tissues. Microbubbles are also incompressible compared to highly compressible tissues, so produce shifts in frequency of the incident ultrasound, leading to the production of higher frequency harmonics. This allows for harmonic imaging, which we shall learn about next. Harmonic mode imaging uses harmonic frequencies. Harmonic frequencies are integer multiples of the center frequency transmitted into tissues. These higher frequencies are the results of the expansion and contraction of microbubbles introduced as contrast agents, or it could be due to nonlinear propagation of the ultrasound as it travels through tissues. In harmonic imaging, contrast agent signals are enhanced by using a low incident frequency and tuning the receiver to receive higher frequencies. Even though higher frequencies are more attenuating, the first harmonic can be used and still produce a strong signal because the incident frequency was a low frequency. Also, these harmonic frequencies will only need to travel half the distance, so we'll still have a strong signal. Harmonic imaging uses longer pulse lengths to allow for higher Q factors. This means poorer axial resolution, but the enhanced contrast outweighs the loss in spatial resolution. The bottom image shows a difference in appearance between conventional and harmonic imaging. So you can see with the harmonic imaging there is more detail, and you can see the image quality is better than conventional imaging. Contrast resolution in ultrasound depends on several factors. We learned in the previous lecture that ultrasound imaging depends on the acoustic impedance differences between tissues. Contrast in ultrasound is because of these acoustic impedance differences as well as the density and size of the scatterers. Contrast is reduced by speckle noise due to scatter from non-specular reflectors, that is, reflectors that scatter the ultrasound beam in all directions. So just as in other imaging modes, scatter reduces contrast. Contrast in ultrasound imaging may be improved by introducing microbubble contrast agents like air bubbles encapsulated in albumin. Microbubbles improve visualization and also perfuse tissues to allow imaging in perfused tissues. We learned a few slides back that harmonic imaging takes advantage of the signals coming from microbubbles to produce enhanced contrast images. A conventional image and a harmonic image are shown on the top image on this slide. Another way to improve contrast is to use spatial compounding. I mentioned spatial compounding a few slides back. Spatial compounding involves combining multiple A-line scans from different angles to form a single image. This process of averaging the information from different angles reduces speckle noise and improves signal-to-noise ratio. This method of imaging improves image quality in breast ultrasound, thyroid imaging, and in imaging plaque. The bottom image shows spatial compounding next to a conventional image, and I showed these two images earlier together with the harmonic image and conventional image were also shown a few slides back. A special application of ultrasound imaging is tracking tissue displacements due to applied stresses from an acoustic radiation force. The tissue response from the applied force is used to produce a stiffness map or elastogram based on strain in tissues or shear wave propagation in tissues. The elastogram is color-coded and overlaid on a B-mode ultrasound image as shown on this slide. Elastograms may contain information related to a wide range of mechanical characteristics of tissue such as Young's modulus. And if you recall, Young's modulus is just the stress divided by the strain. So there is quite a lot of information that can be obtained from an elastogram. Another application is intravascular ultrasound. In intravascular ultrasound, a catheter-mounted transducer with phased array elements or a rotating single-element transducer may be used in interventional radiology and cardiology procedures. Because of high attenuation and minimal penetration depth, high pulse repetition frequencies can be used. This means as the ultrasound transducer is moved through the lumen of a vessel, a stack of images can be collected and volume rendered to show the vessel interior. This can be used to evaluate vessel walls. The image on this slide shows a normal and diseased vessel lumen. Another application of ultrasound imaging is in guidance for biopsy of suspicious masses. This is made possible because the needles used in biopsy are highly visible due to the reflection and scattering of ultrasound under real-time image acquisition modes. The image on this slide shows a biopsy needle clearly as it is guided to the target mass. Ultrasound can be used to produce 3D shaded surface images by acquiring 2D tomographic data in a series of individual B scans of a volume of tissue. Volume sampling can be achieved with transducer arrays by the list of ways shown on this slide. For example, a linear translation can be used, or a free-form motion with external localizers to a reference position can also be used. Also, by using a rocking motion of the transducer, volume sampling can be achieved, or by rotation of the scan lines. A 3D shaded surface display of a fetus is shown on the right image. This is the end of the presentation for today. Thank you for watching this video.